Hi, my name is John Carnevale. I'm Associate Director of Telemedicine at the Erie County Medical Center in Buffalo. You know me as the Telemedicine Coordinator in the DAC system. The purpose of this video is basic telemedicine use with a little bit of insight into what goes on at ECMC's ER. This is the telemedicine equipment. It's run on fancy phone lines that are called ISDNs. You don't really need to know that, but it's good to know that you're not dealing with internet connection speeds. This is one of the reasons why the picture can sometimes look a little grainy. Making the basic call. We are now on the home screen, which is what this is called in the video conferencing system. Up top you see the number that we're going to be dialing. That in this case happens to be ECMC. You can put whatever number is appropriate for where you want to go. What you're going to do next, since you already have the number in there, is just press the green call button. It looks like a headset on a phone. And you'll see that that will start to call. Down at the bottom, there's some symbology for connection of those 3 BRI lines that I mentioned previously. Green means it's connected, yellow and black or gray like that means it's attempting to connect. Once you get all 6 balls lit up green, you know you have a connection. And there we are, we're attached to ECMC. Here we are again at Erie County Medical Center. Time was limited at Wendy, so I had to do a part there and the second part, or maybe even the first part, here. This will be basic interface use of the Telemed system using the remote and what the home screen and different menu options mean. As was mentioned previously, this is the home screen on a Polycom system. You can see in the upper left corner the blinking cursor. That's where you would start to put the number in for whatever number you're wanting to dial. A little more about the home screen. Using the directional buttons, you can move around the menu as you see here. On the remote should be a button that says directory. If you press that, that brings up the directory of loaded numbers that you can use inside the system. Those are usually put in for you. To get out of any of the screens when you get deeper into the menu, press the home button. That takes you back to this screen. When dialing a number, use the remote number pad as shown here, and then simply press the numbers into the system. The system is programmed to give you visual and auditory feedback as to what number you press. For example,
2, 2, 2, 2, 2.
To remove numbers that you've placed by accident, you can use the directional key on the left to move the cursor left. That deletes the number, as you see here. The other way of deleting numbers, depending on your remote, is to use the delete key, shown here. Pressing the delete key once gets rid of each number. So for example, if we're going to dial us or Erie County Medical Center and you know the number but it's not entered into the system because it's blank like this, you would use your number keys on the remote to dial the number.
1, 6, 8, 5, 3, 7, 0, 2, 2.
And then hit the call key. Of course, that call didn't go through because we're calling ourselves. But that was just a test case to show how to dial the number. Now that we've dialed this number, you can go down to the recent calls, again using the directional keys, highlighting that, and then pressing the middle button on the remote as shown here. Pressing that button brings up the recent call menu that shows you what calls have come in or have been dialed out. In the recent calls menu, if you highlight one of the numbers, in this case Wyoming Classroom, and hit the call button, it will call that particular place. Inside our directory is the number or IP address for that classroom. So we won't actually call it, but as another way of dialing a particular number that you're using. So you can use the directory, you can use the recent calls screen, you can manually dial it yourself. Again, to get back to the familiar home screen, there is a home button on the remote shown here. Pressing that takes you back to this screen. The remote has multiple functions that you can use, including zoom, moving the camera around, and that's important so that you line up the shot on the telemedicine system to the patient so we can see the patient as we should. A lot of times, as I showed you from the examples, we'll get pictures of the cabinets, pictures of the window, pictures of the ceiling, and that's not helpful to us. So the functions of the camera with the zoom or with the remote are directional, where you can move up and down. You can go right to left, and you can zoom out. We're zoomed way in right now, as you can see. So in the case of this room, we would want to be the other direction. Zoomed into the cart. So that's the appropriate place to be. So that has been the basic use of Telemed. One thing I do want to say is don't get all caught up in the technology. This remote is basically, if you have DirecTV or Time Warner, the one you won't use at home is more complicated than the stuff you're going to use here. All you're doing is dialing a phone number and waiting for it to connect. The other thing that's important is if you're a little iffy on some of this stuff, pick up the remote, make a call. You can always call me, and we can get you more comfortable with it. You're not going to break the system by using it. So get familiar with the remote, play around with the different camera settings and get used to it. That's the best way to do this, but it's not complicated. One more important thing to remember is that you're the eyes, the hands, and the ears of the doctor at the emergency room. The camera has its limitations and its ability to zoom. It certainly can't feel. It can't see as well as you do. So your job as the nurse in Telemed is to be the eyes for the doctor. Describe things that you see. Don't be shy about telling the doc what you think is what might be wrong, symptoms, signs, feels, smells, whatever. The more information, the better. So don't be afraid to get involved in the patient care. So here we are in the ER. That's the secretary that takes the calls for you. This is the attending station, and then behind him is the residents that take most of the calls. As you can see, they're fairly busy. Coming up, the ultrasound machines, and coming up is the telemedicine library. Now we're going to go inside the telemedicine library and discuss what goes on in there. We're now inside the Telemed room where we do the consults that you call into us. On the right here is the computer that you'll see people feverishly typing on, and of course behind us is the television and video system that we use to talk to you. As you saw from our little walk around the ER, this is a separate room from the emergency room. So in other words, they can't see this TV out there. This is one of the reasons we have you guys call in these requests. In addition, we have the e-whiteboard, which is a visual reminder of consults that are coming in. This is the e-whiteboard that we use here at ECMC. It's actually a website that's run by UB Medical Computing, UB being the University of Buffalo. Up at the top, you can see on the left side a level indication, in this case level 3. In the middle is an indication of where the call is coming from, indications of whether it's waiting, active, on hold, etc. And then in the middle again, where it says test call, is a indication of what is going on. Notes will be put in there such as chest pain, difficulty breathing, etc. A little below where the level 3 is, next to edit and close, is a receive time, and that tells us how long the call's been sitting. Once it's responded to, that middle part fills in, and then the elapsed time is the final after the call is closed. This is the reference chart that we use that has information about all the facilities that we'll deal with in the Telemed system. It has the name of the facility, nurse's station, Telemed room extensions, the main phone number, some fax, speed dial codes, etc. Most important for this training is the hospitals that are associated with your facility. I update these once a year, however they do change. So the point of this is to make sure that you communicate with the provider that you're talking to during the consult. If there's any changes that they don't know about, which we don't, feel free to communicate that with them and let them know that maybe the inmate needs to go to a different hospital because it's closer, or you have a specialty contract, or whatever the situation is. This is the only reference we have. We have no idea what's happening in each local area. When sending paperwork to us, the name of the game is pertinent. Pertinent history, pertinent meds, things that are pertinent to the situation at hand. Occasionally we get paperwork that mentions lab values that go back 6 months. They really have no use in emergency medicine. So just the near-term stuff, the pertinent stuff that we need for the consult, for the problem at hand. Also, please, if you could, write legibly on your forms. It's very difficult to read sometimes, and a lot of times the names are wrong, the DINs are wrong, and that doesn't help us for later charting and making sure these consults have been completed correctly. If you have any issues during your time using the Telemed system, do not hesitate to contact me at the number or email that you see here. When you contact us, please remember that you're contacting a level 1 trauma center in an urban area, which basically is almost always busy. There may be times when you have to wait a little bit to get a clinician here to take your consult, and we do our best to minimize those times, but there are times when there's going to be a little bit of a wait. However, don't be shy about calling back and asking the status of your consult request. I've instructed our staff to make sure they communicate to you some time frames so that you can make a decision as to whether you want to wait or whether you want to move the patient along to whatever destination he's going to next. Since 1999, when the first consult was done by Dr. Ellis, the Telemed system has handled 47,000 calls. That's 250 a month, or 8 a day. Dr. Ellis and I appreciate the work you do to allow the Telemed system to work. We look forward to continuing the program long into the future. Once again, thank you for all you do in making this a successful program.